20-year-old female, headache more than 3 weeks, neural examination, bilateral papilledema. The preoperative imaging will be presented together with the video. This patient presents a small colloid cyst of the third ventricle and hydrocephalus. So she will undergo right frontal craniotomy in a hemispheric approach, transchoroidal approach to remove this colloid cyst of the third ventricle. Let's go to the video. So this is the colloid cyst, axial cut here, and a mild hydrocephalus. A right frontal craniotomy was performed and the inner hemispheric fissure opened. Now he's doing the callosotomy, the transchoroidal approach to reach the right frontal horn, right lateral ventricle. Slowly is opening the corpus callosum, and you can see the choroidal plexus over here, foramen of Monroe. But the septum pellucidum, due to hydrocephalus, is bulging from the left to the right side. So he's making an incision to drain CSF from the left frontal horn or left ventricle. And this is the choroidal plexus of the right lateral ventricle. Region of the foramen of Monroe is completely filled with the blocked by the colloid cyst. This is the column of the fornix. This is the body of the fornix. This is the thalamus. So now he's cutting the tinea fornicis to separate what's the colloid cyst from this thalamus striate vein that will drain this way towards the internal cerebral vein. So now he's opening the choroidal fissure through the tinea fornicis. Now continue to dissect. In colloid cyst, we have to try to free all the adherences that will attach the colloid cyst to the surrounding structures of the foramen of Monroe. So careful dissection not to damage the internal cerebral vein over here. You see, this is thalamus striate, internal cerebral vein, colloid cyst, columns of the fornix. Anteriorly, it's been freed. He's coagulating the colloid cyst to shrink it, to make it easier to maneuver, to manipulate. And then going to the inferior lateral portion of the colloid cyst, cutting out the adherences. And mainly very careful to this adherences to the internal cerebral vein. Now he's dissecting the posterior part of the colloid cyst, not to damage the internal cerebral vein. It's over here, the beginning of the internal cerebral vein. Now the colloid cyst seems to be free, or almost free. Now he's rotating to check if there's any adherence in the inferior part of the colloid cyst. Some minor bleeding, still some adherences. Now it's almost free. Cutting the final adherences. And now the colloid cyst is free and has been removed. Hemostasis, In the end of surgery, we are having a very nice view of the floor, anterior part of the floor of the third ventricle over here. Once again, columns of the fornix, thalamus, choroidal fissure, internal cerebral vein, thalamus striate vein. And this is the sagittal view of her postoperative MRI, showing the total removal of the colloid cyst, and as you can see the size of the callosotomy performed. Axial view of her postoperative MRI, showing the complete removal of the colloid cyst of the third ventricle. And there's no more hydrocephalus.